Hey everybody, it's Dr. Smith. I know I haven't done a video in forever, so I'm gonna try to get better about that. Today I have a patient who has kindly agreed to let me microneedle and video it, so I'm so excited. So we are going to be working on some anti-aging and pigmentation, and today we're going to be using HA35 Plus as our glide. And so we're going to show you all the little bits and pieces that we do. Right now I am going to numb her face, and really when you numb, if you have a lot of makeup, when you're going in for microneedling, you should wash your face before you go in. But if she had come from work or whatever, I would just, if she had a lot of makeup, which she doesn't usually wear a lot of makeup, then I would clean her face off a little bit first and then apply the numbing. But for right now, I'm just going to apply the numbing because she doesn't have any makeup on. So I'm going to get my gloves because I don't want my fingers to turn numb. And basically what I use, it's called BLT cream, and it's benzocaine, lidocaine, tetracaine, and it's just a topical numbing, and it needs to stay on her face for a good 25 minutes. So I'm not going to video it that whole time, but it will be on there for 25 minutes. And we learned last time that to make sure to cover up the lips when we do this, but it does actually seep into the lips a little bit just because of the nerve innervation to the lips and where that comes from. So as you can see, I'm just going to go all over her face with this. I do part of her eyes, so I do put it on her eyelids a little bit, and then as close around. I really want her to be numb because some of the places that I microneedle will be a little bit deeper, and so I don't want her to feel any of that. And she's had it done before. What did it feel like last time?
It wasn't bad at all. It just feels like a comb kind of going over your face.
Yeah, like a metal comb, right?
Yeah.
Like when your sibling puts a comb across your face, not when you do it.
Right.
It's like a little bit hard comb. There we go. I don't really like to be stingy with the lidocaine, with the topical numbing, because I just assume you don't feel anything. So I'm going to get a little bit more. And when you do this, we've already signed the consent form and all of that, but you should be signing a consent form when you do this, and they should talk to you about So as you can see, so I'll finish that thought. They should talk to you about all of the stuff that's involved with aftercare with this, what you should expect over the next couple of weeks, and we'll talk about that again at the end, and then let you answer or ask any questions. So as you can see, turn and look at the camera. She pulls her lips in so that they don't get numb when I put this topical numbing on. However, some parts of her lips will actually get numb just because of the way the nerve comes down and around. Last time her total, all of her lip got numb. Okay, open. Yeah. There. Okay. We'll do your nose. And then, like I said, now you can look at her, just turn towards them. You can see her face is all creamed up. A little bit more here. And then this sits for 25 minutes while I get everything prepared, and then we will be back and we'll show you the rest of it. So we are back, and it's been almost 30 minutes with our numbing stuff, and you can see it's kind of starting to turn a little bit translucent on her face. So we're going to clean it off right now. So first I'm going to wipe it off with just some warm water, and then I'm actually going to put the cleanser on, and I'll talk about that. So this is just water, and I'm just wiping the big stuff off. You should be good enough. Do you feel much of this?
I just feel pressure.
Yeah. There's like a lot in there. That's good. Yeah. Cover your lips. Now I'm going to use, it's called Tri-Phase Cleanser. And it comes off first as a gel that we put on. And you basically let the gel kind of sit and turn glossy. And then I will use water to turn it into a milk phase. And then it just kind of leaves this, not only does it like clean all your makeup, so if she had makeup on, it would clean it all off. It cleans all the rest of the excess numbing stuff off, the numbing cream. And then it actually leaves like this gentle, I don't know, creamy feel afterwards. You know how sometimes you wash your face and it feels dry? So this doesn't do that. I hate it when I wash my face and I feel like my face feels all tight. So this actually makes it feel smooth. I actually use this stuff at home for myself. There's a few different products that I use at home. One is actually Honest Gel Cleanser. I don't know if you know about the Honest company, but they have this really great gel cleanser that does the same thing, pretty much. Okay, so this is just I'm adding water, so you can see it all foams up. Didn't mean for it to go. It just went in her ear. Her ear is really clean now. And then once it's all like that, you just literally wipe it off. Oh, it got on this ear too. That ear's nice and clean as well. Beautiful. Okay, so now then the last part that I do just to clean her face off is that I'm going to spritz it with this this clinical prep that is just to clean the last little stuff off of the face so that we aren't microneedling any bacteria under the skin. And so I always just have to remind them because it's like a shock. Okay, you ready?
Mm-hmm.
Now I am going to change my gloves because when we microneedle, so when we're microneedling, the device that we use has 16 little bitty tiny needles in it. And I'm going to go over her face all over, and it's going to make like 1,000 microchannels in her face. So we don't want any bacteria, obviously. And I want to use sterile gloves. Now we are going to microneedle. So this is our glide. That's what I'm going to use to microneedle over her. And this is HA35, which does some anti-aging and a little bit of pigmentation. That's what she's wanting mostly is pigmentation and anti-aging. And so we're going to start. The pin is kind of loud so that you know this is what it sounds like. And you'll be able to see this whole side, and then I'll do this side and you won't be able to see. Okay, here we go. I'm going to have you turn this way, just so it doesn't run down your face. Sorry, I don't know like this. It's still coming out. It's not our day. You doing okay? Yep. Turn your head this way. I feel like this stuff has a little bit of a interesting smell. Can you smell it a little? It has like a, I don't know, like a mango smell? Oh. Are you gonna go for it? This setting does bring up more conversation. Better. What is it? A little bit, but not bad. You want me to get up to 25? Yeah, I'm okay. You want to do your cheek? I'm going to have you turn your head. Yep. I'm going to be down here. Ready? I'm going to start here. Probably faster. Okay. Sure. You okay?
Mm-hmm.
Okay. You want to turn? Very quick. You're really good at cutting the lines too. I'll have you turn your face a little bit more. Yep. There you go. You okay? This part is kind of sensitive. You okay? The cheekbone tends to be the most sensitive. Does that part bother you at all? Yeah. It does. No? No. No. The cheekbone does. It's not the cheekbone. Okay. You're ready to turn? Yep. It's an inch. It's not a thing. Oh, today. It's just like hard to push it off. Okay. Now look straight up, and you're going to cover your lips. Okay, and then go around her eyes. Okay. And what, yeah, like, try to look up. You okay? Is it bothering you?
A little bit down there.
Yeah. Okay. I'm gonna do this other eye. Okay. It's turning just slightly up. Put down cheekbone. And go lower. That's okay. Okay. Keep going. Okay. I'm gonna do it over your. I'm gonna just do it over your eyelid.
Okay.
There we go. Okay, you're gonna do this side now. That's perfect amount. Okay. I'm just gonna rub this in.
Okay.
It's like the last little bit. You have. I'll get your eye in this. There. Did I make you cry?
No, it's just
Your eye
the-
tears. That's what I
yeah.
have. Okay, so can you look at the camera? You can kind of see. Okay. All right, are you ready? It's gonna be cold. It's probably like your mask that you have at home. You look like you're in a sauna. Okay, this is her with her mask. It's actually been on now for about 10 minutes. And so we're going to take it off. Remember how red her face was? So we're going to take it off. She said at first it, oops, sorry. She said at first it kind of, I was sorrying because I removed you from the screen. She said at first that it kind of stung a little bit. You guys missed that part, but you can see that now I'm like rubbing her face, but you can see that like her cheek area is actually pretty white now, and on this side too. And then she has some redness all over, but nothing like she had before. And so this was just a hyaluronic acid mask. So now I'm going to put some vitamin rich repair on her, and then it's called Cover Recover, and it's clear, and it's a sunscreen. And so I'll show you what she looks like when we're done with that. Okay, guys, you can see that she is still kind of red, but not as red as when we finished. Mostly around her cheeks and like on her eyebrow area is a little bit red in her forehead. And I guess her chin. But all of that will calm down by tomorrow.